Good morning, good morning, good morning. Welcome to Mobility Magic. Hello, hello, hello. If you're just joining us on the replay, we are in for a forearm, wrist, and front arm line mobility session today. So if you're joining us for that, if you've been sat at your desk and you have excess tension through the arms, this one is for you. And if you don't, or you don't realize you do, join us in the session and let's see how we get on. Good morning to you if you are joining us, if you're a regular. Good morning if you are joining us for the first time. And hello to everyone else. Love to see you guys. Just gonna give it 1 minute to let a few more people come in. And again, we are working on a little bit of forearm and front arm line, and if we get a little bit of time, we'll also do a little bit of shoulder as well. But I think we're gonna have a lot of time spent on the forearms and biceps today. So we'll do a little bit of stability at the end too, because I want to make sure that people walk away nice and stable and strong. Otherwise, we're gonna crack on with our session. So I'm just gonna turn the comments off. Now, just to add, as I normally do, if you have any feedback, anything you'd like to pass on to the team, feel free to leave the comments after the session when we repost the video, but otherwise, welcome to those of you that are joining us this morning. Okay, so just gonna start the comments. So for today's session, you see me holding a lacrosse ball. You will need something similar, maybe a tennis ball, maybe a lacrosse ball, or if you have something else like a golf ball or anything else that will do that's a little bit rigid, that's for the forearm release today. So you'll also need a surface. So if your desk, that's perfect. If you are in your front room, a chair will do. I have a chair because I find that's the most common thing people say they have. So that's how we're going to start. Now, the first thing we're going to do is we're not going to need the lacrosse ball, but we will put it to the side for a second. We're working on wrist mobility today and forearms especially. It's an area where a lot of people ask me about what to do mobility-wise because they have excess tension. It also contributes heavily to difficulty with the shoulder, because the tension will kind of leak up into the shoulder and the chest, and some people find it difficult to do some things like push-up, for example. So we're going to work on that today. So first things first, we're going to do a little bit of a wrist roll movement. So fingers together, about chest height. We're going to pull your shoulders right down, so we're locking those in place, and we're just using the wrist. Don't need to be waving your elbows around. So again, shoulders down, wrist rolls, figure 8 pattern. So just painting the corners, trying to keep it just in the wrists if you can. We're just trying to get those wrists loosened up. And if you have a wristwatch on like I do, and you don't have it loose enough, if let's say you like to wear your wristwatch quite tight, I'd probably lose that for now as well. I'd probably just take that off, okay? So again, shoulders down, pulling right down to your hips, just moving from the wrists. So we're now going to take our hands, we're just coming into this kind of hands together position, kind of coming in this prayer position. And what we're going to do is we're just going to pull down, just pulling down from the top. And as we come down towards the center line, we're just adding a little bit of tension in. So I'm pushing my hands together, getting a little bit of a stretch on the wrist. I should feel it on the outside edge of my hands. That's on my wrists, just on the top, as I bring it down. So again, I'm keeping my shoulders back and down, pulling my shoulder blades to my hips, and pulling my hands down to the floor. Again, a little bit of a light stretch on my wrists. And it also feels nice in the shoulder if you're just starting to get the shoulders to do some work by holding the shoulders down isometrically, just pulling down to the floor. Okay, so next thing we're gonna do is we're just gonna open this position up, just bring it forwards and back, doing the same thing. I'm just coming back, and as I get to the center towards my chest, I'm just pushing my wrists together, just create a little bit of tension. Again, keeping my shoulders back and down. Now, if you have any trouble getting it to your chest, you can just open your wrists up just a little bit to ease that tension. Now we're going to bring our hands together on the back. So we're just going to do some forward rolls, some back rolls, just coming out all the way around. So we're just rolling around this position. We want to have a little bit of tension as we bring it to the center. Again, keeping the shoulders back and down, just working from the wrists. Okay, so that would just be our first mobility drill. We're just trying to get some synovial fluid, some joint movement. We're just trying to get the the radius in the ulna to articulate a little bit. Just glide backwards and forwards, and we're just getting the fingers to work as well. So now you're going to need your chair. I will try and give you the best view possible for these particular stretches, but the first thing we're going to do is we're just going to check in with the movements and kind of the range of motion with the wrists. So I'm bending forward. I'm going to have my hands flat on a chair, or if it's on a desk or a coffee table or something similar. So we're just applying a little bit of downward pressure. Now we're going to lean forward just to kind of see where we're at. Now, if you're someone who has restriction and you can't quite get to this position where you can bring your body weight over the wrists, I would suggest probably about a 5 or a 6 out of 10 in terms of pressure. You don't want to add too much, you don't want to blow past it, especially because later on we're going to be adding some stability to this range, and it can be quite uncomfortable if you have gone way past your range or stretched too far. So again, shoulders back, nice flat back, we don't want any curved backs. Putting some downward pressure, so my shoulder is stacked over my wrist, and I'm leaning forward. We're going to do that about 5 times. Okay, so 1, 2, 3, 4, and 1 more, and 5. And now we're just going to do some circles, so we're going around the wrist now. So we're just shifting our hips from side to side, just to kind of open up that range, a little bit of downward pressure. Again, if you find it gets too intense, just back it off slightly, just shift your hips backwards. And if you need a little bit more, you can just lean right across the top. Okay, so now we're going to turn our hands, we're going to turn it outwards this way. So if your chair's too small and your fingers slightly go over the edge, that's not a problem at all. Again, just shifting the hips. We're just working on a slightly different range. We're going to shift it forwards and back, just trying to keep those hands down on the chair, trying to keep that tension, just keeping our back flat, using our hips to shift forwards and backwards. Now, if you need to take a break, because again, 5 to 6 reps can be pretty intense, just come back to that first position of the hands together, because that can often lead to a little bit of a relief in this position. Just roll forward and backwards, or you can just do your wrist rolls again. So 5 reps at a time, do a little bit of relief, and then we start again. So we're going to, first position again would be just rocking forward, and we're going to do another set of each just to work through this series. We're rocking forwards and back, a little bit of downward tension, want about a 5 or a 6 out of 10 in terms of tension, using my hips to shift backwards and forwards. Then we came around, so we're going to do some clockwise, anti-clockwise positions just to get those hips to mobilize a little bit, and then we're turning our hands out to the sides, and we're going to rock from side to side, and then we're rocking forwards and back. You can also do a combination of all of those things if you want to, but for today's purposes we're just going to do 2 rounds just to keep it brief. It's probably not worth doing too much in terms of thrashing your forearms, because again, if this is something you're just starting to do, it can be quite intense, and it's frequency over intensity, as we often say. So we're going to take our lacrosse ball, and we're going to work a little bit on the forearm flexors. So we're just putting the ball onto a surface, and again, if you have something else like a foam roller or a golf ball or a tennis ball or something similar that you can put some pressure into, that's ideal. You can turn the chair towards you can see. So we're going to start more towards the meat of the muscle on the forearm, and we're putting a little bit of downward pressure, so you can see the ball right here. So there's 2 options here. We can get our weight over the top of the ball, or we can just apply a little bit of direct pressure to the forearm. If it's extra tender, I myself need a little bit more pressure because this range for me isn't an issue, but again, I appreciate a lot of people have issues here, so we're going to work on it together. So first thing I'm going to do is make sure that we're close enough to the edge that I can bring my whole hand, I can flex it down to the floor, and I can also come up into full extension with the wrist. So downward pressure into the ball, into the meat of the muscle, closest to the elbow, and we're going to bring our hand all the way up at first with a little bit of pressure, let's say a 5 out of 10, and then we're going to bring it all the way down. And this time what I want you to do is combine it with a breath. So we're going to breathe in, and as we apply pressure, breathing out. We're going to move to a new position. Find a little bit of tenderness if you have it. If you do, just dial back the pressure, okay? So breathe in. Breathe out as we bring it down to the floor. We're just taking away some of that tension. We can roll it backwards and forwards just a little bit. So I'm just rolling it across that area, finding somewhere new. I'm adding a little bit of pressure as I come down. I'm breathing in. I'm breathing out. So again, breathing in, breathing out. And if it starts to get a little bit nervy, just come off the ball and just roll your wrists. Again, that's another common thing we find. So again, find a new position. We're going to do this one more time, and then we're going to flip over to the other side. We're going to do some extension work. So we are putting downward pressure. I'm a little bit closer, so I'm about 3/4 of the way up my wrist now. And you can rinse and repeat this as many times as you need to release the wrist. But you might find that the closer you get to the wrist, the less range your fingers have, because you're putting a little bit more tension to the tendon. So you're going to pull down. We're going to breathe in. And we're going to breathe out. And again, if you need to get your body weight over the top, that's fine too. And down we come. Awesome. Going to flip our hand over this time, so my palm is facing my face, and we are going to do the same thing on the opposite side. So if you already worked out how this is going to go, you can jump straight ahead. But again, same instructions. So this time though, because there's a little bit less surface area on the underside, we actually have to slightly turn our wrist outwards, which you can use this hand to manipulate your forearm if you need to. And we're going to put a little bit downward pressure with this hand, and this time we're coming down first, so extending our wrist, and then we're breathing out. So breathing in, breathing out, breathing in, breathing out. Take the pressure off just a little bit, find a new position. We're going to work proximal to distal, so working from elbow to wrist on this one. And breathing in and breathing out. Make sure your pressure is directly over the top of the ball. And breathing in as we bring our fingers down to the floor, and breathing out. One more position for this one, because again, this one's really easy to do, so kind of once you know how this one goes, it's really easy to add this into your mobility at your desk. I find sometimes if you sat in front of the computer, you've done a lot of mouse work or keyboard related stuff, and you have a lot of hypertonicity in your wrist because you've been in this bent position, this can often help to release some of that. So next thing we're going to do is we're going to move around. So we're going to do the other side, then we're going to come back to do some work locally to the fingers, just to kind of get those mobilized too. So I'm just going to change sides so you can see, just moving around here. We've got camera angle right. So let's start the same way. This is my left wrist. So same applies. If you've got the gist of what we're doing, feel free to jump ahead. But this time our palm is facing down. We're getting a little bit of direct pressure over the top of this lacrosse ball that I have here, but any ball will do with this, anything with a little bit of give. And we're putting a little bit down pressure, and this time we're going to breathe in and breathe out as we come up. The breathing can also work in reverse if you find that you've got a lot more tension at either end of the range. You just want to make sure that you're breathing out as you get into that kind of tense spot. So breathing in on the way down, breathing out on the way up. If you need to come back to find more tension, that's okay too. It won't necessarily be this way, but for now I'm just going to move from my elbow to my wrist. Okay, so direct pressure downwards, breathing in as the hand comes down to the floor, and breathing out, trying to get my fingers to the sky if I can. And again, just make sure you're not adding too much pressure to this movement, because you have some delicate structures in this areas. If you have things like carpal tunnel or a tendency to get too much tension through your wrist, or any existing wrist trauma that you've already had in the past from, let's say, a slip or a fall, don't want to add too much to that. So just back off the pressure, less is more, okay? One last position to do for this side, and again, if you kind of got the gist of what we're doing, we're putting a little bit down pressure, so heart over the top would be easiest, and we're just bringing our fingers down and then all the way up, a little bit of pressure, so breathing in, breathing out. And if you've just joined us and let's say you have a wristwatch on and you have a tight strap, feel free to take that off because that's also going to help to take away some of the tension closest to the wrist. So this time, palm is up to the ceiling, up to your face. We have a slight externally rotated bias because the musculature is on the outside of our arm on the side, and we want to get the most out of this position. Okay, so again, body weight over the top. Let me just turn slightly so you can see. Body weight over the top. Find a position which works for you. It's a little bit of tension, bringing the fingers down and then all the way up. So breathing in and breathing out. Any position which you feel a little bit nervy in, just back off the pressure, okay? Breathing in and breathing out. Awesome. You're gonna find a new position. We're gonna go for 2 more positions on this side. 2 more positions on this side. So again, use this hand just to control the position of the wrist because the musculature's on the outside for the extensors. It's gonna be a little bit of a twist of the wrist to get into the right position. And again, if you can't quite see, let me just turn the chair a little bit so you can. You're gonna see that my wrist, or my elbow I should say, if I'm on this side, my wrist is just turned slightly with this hand. I'm just finding a position which works and a little bit of tension. So let's just do that again. So again, we've got 2 more to do, sorry. Wrist is gonna come down, or hand's gonna come down, hand's gonna come to the sky, so breathe out. So breathing in, breathing out. And this time, breathing in, breathing out. And it doesn't really matter which way around that you do the breathing, but the pressure needs to come on the out breath, okay? So next piece for this, we've done our extensors, our flexors, so we're going to do a little bit of work on the fingers now, okay? So we're going to come back up to our standing position. We're going to lose our lacrosse ball, so you just put that to one side for a second. And we're going to work on lifting each finger with a little bit of tension. So if this is a little bit too advanced to you, if you find that you get nervy or there's too much tension, just skip ahead of this one because this could be pushing it slightly over the limit for you. But if not, we're going to continue with the same position we started with, where we're in this nice flat back position, equally weighted over our feet, and we're going to add a little bit of a forward lean. Now, we're just going to focus on the left-hand side this time, and then we'll move across to the right. But those of you who've done this one before, shoulders stacked over wrist, slight forward lean, just to check if there's an improvement in the range. And then we're just going to back it off a little bit to take the tension off, because it's going to be very localized with the fingers and the thumb. So first thing I'm going to do, your choice whether you start with the thumb or the finger, but we're going to lift a little bit of I'm going to do my little finger on my left hand, lifting my finger up. I'm just leaning forward slightly and towards the little finger, and then putting it down. I'm going to take the pressure off. I'm leaning my hips back, and then I'm lifting the next finger up, and I'm leaning forward, so that ring finger up, and then I'm shifting my weight back, and then forward again, just to find that tension spot, and then letting it down again. I'm backing off a little bit. I'm lifting that middle finger now, and I'm leaning my weight forward. A little bit of a stretch. You need a little bit more fine, but you don't want to blast past that in range, because again, we're not trying to strain or cause pain. So we're just lifting that pointer finger up next, index finger. So we're leaning forward a little bit to add some tension, and then we're just going to do our thumb. Thumb has a lot more range, so we're actually going to shift our hips to the left this time as we lift it up. And you can also add, if you find that you have extreme range in this position, I can show you a little modification which you can do on your own in a second, but I'm going to switch around so you can see again on this side. A little bit of downward pressure, get yourself into a nice comfortable position. You can also do this kneeling if that's more comfortable, or seated if you have a desk. But we are going to, again, lean over. Our body weight should be able to shift forwards and backs. Just get yourself in a nice comfortable position with a flat back, so we're not rounding nice flat back, okay? So shifting our weight forward slightly just to find the end range. We just see where we feel the tension. Our shoulders stacked over our wrist, and we're just leaning our hips off a little bit to take some of the tension away from the rest. So first thing I'm going to do this time, we're going to start the other way around so you can see what I'm doing. We're going to do the thumb first. Now you can do finger or thumb, up to you which way you start. I'm just working one direction so you keep consistent. So we're going to lift the thumb until it's straight. So we want to make sure the thumb's straight, and we're following the line of where the thumb straightens to. So for me, it's heading actually more towards my arm, so I'm going to lift slightly. I'm going to shift my weight away from that position. I'm going to make sure I'm breathing as well. That's the other thing I forgot to say earlier. And then we're going to relax it off. We're now going to do our pointer finger, so we're going to lift that up. So I've shifted my weight back first, and then I'm leaning forward a little bit to add that tension. I'm leaning back, I'm leaning forward, and I can go longer with these. I can just pulse in and out if I want to, or I can even add a little bit of an isometric. So an isometric base would just be me pushing down, okay? Or a concentric, let's say concentric in this case would be contraction, and then a relax, and let's just see if that range improves. It might do. So we've contracted, and then we're relaxing, get a little bit more range, okay? So let's do the middle finger. Let's lift it up. We're shifting our weight forward and back, and we can oscillate in and out if we need to. Again, just a modification you can do on your own if you need to, but for now we're just lifting the fingers and we're shifting our weight forward, okay? And then the last one is just our little finger, and we're just lifting that one up too. Awesome. Shifting our weight in, shifting our weight out. Okay, so now that we've had all that tension through the wrists, I want to go back to our first kind of wrist roll position. And we're just gonna roll through that range. You might find it starts to crunch or click, or you might have some new movement. You might find that this range is better. Pulling our shoulders straight down, so we're getting this like lat pull down. We're doing the rolls of our wrist. We're just moving from the wrist, just moving from this position. Okay. And then we're just gonna go into our prayer position. So these can also be a bit of a check-in as well. So remember we had fingers up first, sorry. We're coming straight up, pulling down. See if you get any more range in this bottom position. If you do, clearly it's a really good thing to add into your stretch mobility routine, because it can really help take some tension out. Now, some of you are probably thinking, well, why is this important for us? Why is this gonna help us? Well, if we're struggling, let's say, with end range for a push-up, or if we have excess tension that kind of leaks into our shoulders and chest, and we're not really sure where we're coming from because we've stretched our chest, we've stretched our back, we don't know how to release it. Well, we tried our forearms now, so why don't we have a look in a minute if that is what is causing the issue. So we'll do a little bit of a check on the floor. So again, the last one all the way down. Now we're coming back towards the center line. So these are kind of good beginner stretches, also a really good check-in point if you're looking to qualify whether there's any end range improvement. We're going to come to our rollout, so we're in this kind of back hand, kind of opposite prayer position towards us, and we're rolling all the way out. Bring our thumbs round, come all the way out. Again, keeping our shoulders back and down, coming all the way out, just rolling round the wrists, coming this way around. Okay, so just shake them off. Last thing I want to add is we've taken out this front line tension, but we want to do a little bit of bicep work too. One last stretch we'll do, and then we'll do a little bit of stability on the floor, just for the shoulder, is a slightly modified bicep stretch. Now you can do this with a band, you can do this with holding onto an object like a banister, etc. But I like to do this one just by bringing my hand, so cupping my hand behind me. It's a little bit of external rotation, or sorry, internal rotation. So external would be this way, internal would be this way. We're internally rotating, so we're internally rotating this way, so my shoulder then points inwards, okay? Sorry if that confused anyone. My wristwatch wants to face inwards, and then what I'm going to do is I'm going to start to pull my shoulder down towards my hip, and I'm going to imagine that my hands start to raise like a clock hand behind me, and at the point I get the tension, I'm just going to hold it. I'm going to take a nice deep breath in. Excellent. So just back that stretch off again. we're trying to internally rotate, so my thumb would be turned towards me. I'm cupping my hand upwards to shorten the distance, and then I'm pulling my shoulder down towards my hip, so I'm down towards my hip, and then I'm lifting my arm behind me. Sometimes I say I like to use an object to hold on to behind me, and then I just walk away from the object, and that gets a good stretch across the bicep too. But the important bit is that you are internally rotating the arm and it's completely straight, so you get that nice bicep stretch. So next thing we're going to do is we're going to do the other side. So again, cupping that hand behind me, I'm internally rotating my hand, so the more range you get, the better. If you have any excess tensions running through that forearm there, just back off the stretch a little bit. We're going to pull our shoulder down towards our hip, and we're lifting away from my hip without bending my elbow. I'm reaching back, I'm breathing in. And as I breathe out, there's a couple of things you can do here. You can pull your shoulder towards your hip more, and you can actually raise that arm the other way. So take a nice deep breath in. And I'm raising, breathing in. The last modification you make to that one is you can just internally rotate slightly more. So I want to add a little bit of stability to this range that we've worked on it. If you haven't fried your wrists and you've got a little bit more work that you can do here, I like to load this position from the floor because I find it's easiest to kind of adopt these positions for most people. And we're going to assume kind of this quadruped position. So we've done this before. We're going to make sure that our shoulders are over wrists if we can, if we gain that new range. This can also be a good check-in for a lot of people, because if they can't get their body weight over their hands for a push-up, maybe you can now. So this is always a good one. So first thing we're going to do is we're going to make sure that our knees are under our hips. We're actually going to push back to load the wrists. So shoulders are stacked over hands, knees are under our hips, and we're just going to push back enough into our hands, pull our shoulder blades down, that we can lift our knees off the floor about an inch or two. So if our shoulders are stacked, this should be quite easy. If we have any excess tension, we're leaning too far across our hands, that can be quite strenuous. So again, reason we'll do this, good closed chain exercise for us, pushing into the floor, just holding that position. We can shift our hips if we need to, we can lean forwards and back if we want to. We can also check that push-up position if you want to as well, to see if that's improved. But we're just going to do that 2 more times. So again, nice closed chain exercise, really good to prep for benching. We're just holding this position after we've mobilized, lifting our knees off the floor, just holding this position with our shoulders stacked. Good core exercise too. Just holding that position. Bring it down. See if you need to have any recovery at all, or if you're ready to go back into it. Just again, going to stack your shoulders, make sure they're shoulder width apart with the hands. Make sure that your knees are stacked under your hips. Nice flat back, lifting your knees off the floor. We're just setting some stability into the shoulders, making sure our wrist range is good. We can shift our hips if we need to. Nice neutral position with the head. Okay, so second position we can use. We can do a little bit of a crab position. This one's good because it's going to enable us to stabilize our shoulders with an external rotation and a retracted position. So feet want to be about shoulder width apart. We're going to have our feet flat on the floor for this one. Our hips are shifted backwards and our shoulder blades are pulled together at the back. So shoulder blades are together at the back. I think that's a good position for you to see me in. So hands are slightly externally rotated. So facing kind of about 10 o'clock and 2 o'clock on the clock, and we're lifting our hips off the floor. And as we do that, we're keeping our shoulders pulled back and down towards the floor. So again, I'll turn a little bit so you can see my back. Shoulder blades together, pull down to the floor. I'm just adding a little bit of pressure into the floor as I drive my shoulder blades down, keeping my wrists nice and straight. And as I get more comfortable, I can work my hands in, shift my hips back, keeping my arms straight, and then I can shift it in a little bit more, pulling nice and hard down to the floor, squeezing my shoulder blades together. Now I can rock backwards and forwards from this position. I can even work on lifting my hands up by shifting my weight from side to side. So really, really great closed chain activity just to help stabilize the shoulder in that end range. So we've done a little bit of wrist release with rotation as well. Get some synovial fluid in the wrists. I should turn the comments on now, coming towards the end. We've done a little bit of stability. I would highly recommend giving the stability a go and see how that works for you. That stability piece right at the end is awesome before you do anything that's pressing related, before you do anything that's push-up related, because it's really going to help set the shoulders in the right position. Okay, so thanks so much for joining us. We have a second session on Friday this week. You can check the story and the Good Life timetable to see when that is. I believe it's 1:30 on Friday. That's Good Friday, a little bit later. So we'll probably do a little bit of lower body work, or if anyone would like us to work on anything particular, you can always message me directly, or you can leave a note on the video that we post afterwards in the review section. So thanks so much again. Always great to see you. My pleasure to teach you every week for these Mobility Magic sessions. And if you have any feedback or anything you'd like to see, please send us a direct message and we'll see if we can action that for you. But otherwise, have a great week and we'll see you soon.